Now we're going to talk about what to do if you aren't able to get a blood sample as easy as I was on Sherbert earlier. There's a couple tips and tricks that I like to use. One of them is you don't have to have this cap on your lancing device in order to poke the ear. Some of the devices come with this opaque one that is very difficult to put over to milk that blood sample out. So just be careful with it. I mean, you don't even need to use this lancing device if you want. You can just use the needle by itself. Again, holding a flashlight up to that ear makes a big difference because you can really see that lateral ear vein that we're going for. And if you want to, you can simply just use something to support the ear and poke along that lateral ear margin with the lancet here. As you can see, I got a little drop, and I have a cap, clear cap that I can use to kind of milk some of that blood out, or sometimes you can squeeze it a little bit to get a little bit of that blood out. Other spots, you can poke this back side of the ear too. I've had some clients have some really good success because you can see the vein better. On Sherbert, his is quite prominent. It's just sometimes when you do that, they're a little more reactive. But I do have a spot right here. I poke on Mr. Sherbert here, and we can milk a little bit of blood out of there, and then use that for the sample as well. I don't know if you can see that blood drop, but that's a really nice blood drop right there. And then one other spot you can poke. It's not ideal, and they do react more to it, but you can use this carpal paw pad down here. I like that one because they don't use it when they dig in the litter box. I'm not going to poke him because they are a little more reactive and sensitive to it, but that is always an option if we're having difficulty getting blood at home for a glucose curve. Yeah, that's all for part 2.